Hi everyone, today we're going to talk about equality and food insecurity. We really have to have a conversation about equality before we talk about food insecurity. So we're going to focus on income inequality first. The slides that I'm going to use are based off of a film that you can rent or buy called Inequality for All. You can watch the trailer or play the movie in a lot of different places. So just wanted to give you the link in case you want to follow it. But there are a series of really great graphics that I want to use for the first part of this lecture. So when we're looking at equality, we want to first get the background picture and an idea of what's happening. One way that we can look at how equal our society is to examine the differences between the top and the middle classes. You can see in this graphic on the left that in 1978, the typical male worker was making about $48,000 per year. That's your average individual. Then you can see on the right that the typical person in the top 1% was making about $393,000 a year. That's a really big difference. And in 1978 dollars, that's a really big difference, but it doesn't even compare to what's happening today. So today, or in 2010, as this slide indicates on the right, the average income for the middle class has gone down to $33,000, or about $34,000 a year, whereas the typical person in the top 1% is now making over $1 million a year. So this is dollars in 2010. So not only is this gap obviously a lot larger because it's 33 to 1.1 million, but $33,000 does not go nearly as far as the $48,000 in 1978. So this adds up to mean that the top 400 richest people in the country today have more wealth than 150 million Americans put together. In other words, the wealthiest 400 people have more money than the bottom 150 million people put together. And it wasn't always like this. There have been times when wealth aggregates in the hands of a few, but there's been a historic ebb and flow to it. On the graph on the left here, you can see that this is the top 1% income share. So in other words, this describes what proportion of the income the top 1% has. You can see in 1928 it was nearly 25%, and it fell for a period of time as it climbed again in 2007. The top 1% again held about 25% of the income. Let's look at these two peaks. So what happened in 1928 and in 2007? We had two stock market crashes, right? And there are some parallels that led to these crashes. So there are three main things that happened. Income concentrated in fewer and fewer hands, which means that the financial sector also ballooned. That happened in 1928 and in 2007. Also at both times, capital was a very limited number of financial assets. It was concentrated in housing, gold, and a couple other major things. That also created kind of a bubble. We all heard about the housing bubble in 2007. There was something similar that happened in 1928. And then lastly, middle income earners saw their income completely stagnate. So people in the middle class did not see their income rise as the cost of living rose. So they went into debt to maintain their living standards, which also created a debt bubble, and that bubble also eventually burst. We can also see that something happened in the late 70s or early 80s that caused the income to become concentrated in the hands of a few again. So that's where we see this graph starting to rise. That means in this graph that the income is becoming more and more concentrated in the hands of a few people. And what that was neoliberalism. Neoliberalism refers to a political economic philosophy that de-emphasizes government intervention in the domestic economy. And while many of us think of this as a Republican or GOP value these days, at the time, this started under the Carter administration and extended into Reagan's administration. So this was favored by both Democrats and Republicans. And basically, it was a series of policies that favored big business, banks, and de-emphasized our government. So there was a focus on free markets, there were fewer restrictions on business operations, We favored globalization and privatization. And then there were rejections of labor policies like minimum wage, unions were de-emphasized, socialism, etc. The opponents of neoliberalism were anti-globalization advocates, environmentalists, and food systems advocates. And there were many changes that resulted, including the decrease of labor unions, globalization increased, and policies that favored big businesses increased. To look at this in a little more detail, we can see that labor unions declined in the late 70s. The orange graph shows how union membership rate decreased from nearly 30% downward to 2007. And in the beige graph, we can see that the middle class share of the national income also decreased. So we can see that these declines nearly match each other. As union membership rates decreased, so did the middle class's share of the national income. In fact, if you layer these graphs on top of each other, then they mirror each other almost exactly. The orange is still union membership rates, and the gray is the middle class's share of the national income. So unions were benefiting the middle class. In addition, we saw an increase in globalization that was also related to the increase in technology. So obviously there were no iPhones in the late 70s or early 80s, but on the left you can see that when people were surveyed, this is where they said they thought their money went. They thought about 70% of it stayed in the United States because Apple is an American company, about 23% went to China, and then about 7% went to other countries. On the right, however, we can see where the dollars actually go. So very little of it stays within the US, only about 6%. 34% of the money goes to Japan, 17% to Germany, and only 3.6% to China. The iPhones are assembled in China, but the pieces come from everywhere else. So as globalization and technology increased, it impacted Americans' pay rates. Despite what we might think, it didn't actually reduce the number of jobs here. Can anyone think of why that might be, that it didn't reduce the number of jobs? It was because these jobs didn't exist before. Jobs in technology, making technology, didn't exist prior to the early 80s. So the main impact of globalization and the increase in technology was actually on how much Americans were earning. You can see in the 70s, a bank teller was making about $28,000, where in 2010 they were only making about $24,000. Similarly, in the 70s, a meat packer was making about $40,000, whereas in 2010 they were only making $24,000. So the middle class saw their wages stagnate, which means that they have no opportunities for upward mobility. Ultimately, this had a massive impact on inequality. So again, let's review what happened. In 1928, the stock market crashes, and income inequality begins reducing. Then World War II happens, and we really see income inequality reduced after that. That means there was a big middle class. As we started to recover from the war, the middle class grew even more, and we saw that there was more equality in the 50s through the mid-70s. This means that people were making enough money to live and to maintain their standard of living. Then we can see as neoliberal policies began to take effect, income inequality increased. In other words, we began to see the effects of the neoliberal policies in the early 80s. That's when middle-class workers' income stagnated and executive workers' pay increased. As the middle-class wages flattened, then they did three things to try to cope with that. Women went to work, people worked longer hours, and people went into debt, particularly into housing debt. And as more of the middle class went into debt, then we began to see this downward spiral. The rich got richer, they had more money to influence politicians and government actions, whereas the middle class had less and less and less. Here's another way to look at it. On the x-axis, we have time in years, and on the y-axis, we see average household income. In 1980, while most people's wages remained constant at around $50,000, the top 20%, but particularly the top 5%, continued to see an increase in their wages. So most people's wages stayed the same, while the top 5% began to earn more and more. And on top of that, taxes for the rich were low. On the bottom of the graph in the blue line, these are the taxes for the lowest wage earners, and the red line are the taxes for the highest wage earners. So in 1980, the top 5% saw their taxes decrease, which means they were able to keep more of their money, while the lowest wage earners, the bottom 80%, saw their taxes increase, so they were able to keep even less of their money and they were going into debt. So this combination of events, the increase in wages and decrease in taxes for the top earners versus the stagnation in wages and increase in taxes for the lowest earners, led to the rich getting richer and the poor getting poorer. So while there's no definition of the middle class officially, the median salary in the US is about $50,000. So from about half of that to 1.5 times that, or $25,000 to $75,000, can be considered the median household income. The bottom of the 1% makes about $380,000. So that's the lowest income of that 1% group. The average income of entrepreneurs is about $3 million, whereas the average income of CEOs, various people in the financial sector, athletes, celebrities, actors, that can range up to $10 million or more per year. So this group of the top 1% has a range of $380,000 to over $10 million a year. And there have been policies in place that facilitate this. For instance, the way that the top wage earners are taxed. In about 1930 through 1960, you can see that taxes for the top earners were relatively high. They were 63 to 79% under the New Deal. Eisenhower made them 91%. And then we started to see a drop in taxes. Nixon dropped it down to 70%. Reagan dropped it down to 50%. And then Bush dropped it down to 35%. Obama pushed it back up a little bit, as you can see by the very end of the graph on the right side, but it's not nearly the rate that it was in the 30s through the late 70s. And the way that people tax is critically important for two reasons. One, taxes can either create more of a wealth gap or less of a wealth gap among a population. And two, taxes are a part of the way that we pay for social programs, like those related to food, including food stamps or EBT, including the National School Lunch Program, etc. So as the wealth gap widens and society becomes more unequal, then upward mobility between classes becomes more difficult for people. In other words, it gets harder for the poor and middle class to move into the upper class. And we see that in many ways. One of them is by measuring the number of kids who are born into poverty that stay in poverty. In Great Britain, it's 30%, in Denmark, it's 25%, whereas in the United States, it's 42% of kids who are born into poverty will stay in poverty. Social mobility was easier and was achieved when incomes were more equal, when there was less of a gap. We can call this period from 1947 to 1977 the Great Prosperity. Income inequality was low, and people were doing relatively well. During this time, more people were going to college. We actually saw a massive increase in higher education. So in 1940, it was only 5.9% of people seeking higher education, and until 77, that number increased to 24%. We also saw a rise in the number of unions. So union membership went from about 24% in 1940 to 35% in 1950 and climbed just a little bit higher after that. And we know that workers benefit when they're part of unions. So you're probably asking where food policy fits into this big picture, where public health fits in. So we talked about that there's been deregulation since the 1980s. That includes in agriculture, on Wall Street, and in food marketing. So let's look into how exactly in each of those areas. Deregulation in agriculture affected family farms. During the Great Depression, we saw an increase in the number of subsidized crops. In essence, the government was helping stabilize the price of food to ensure that farmers could continue to afford to produce it. As technology evolved and machines became more popular on farms, farmers were able to feed more people. To keep up with those changes, though, farmers had to leverage themselves by borrowing money to support the expansion of their farms. In the early 1970s, interest rates were very, very low, and so farmers borrowed more because it was a pretty good deal to get more money. They could increase the size of their farm by borrowing more. Then the price of oil and gasoline increased after an embargo in 1973. So with an increase in the price of gasoline, farmers were making less money. And then on top of that, interest rates were deregulated in the early 80s so that they went up by a lot. So farmers went more and more into debt. As they went more and more into debt, we saw more farms close or being bought up by other farmers. So the number of farmers overall decreased while the size of the average farm increased. Many farmers found themselves out of work, and as a result, the subsidies essentially became ineffective because now there were these very large farms that were producing enough food and didn't need stabilization from the government. So there was an abundance in the food supply of those crops that were being subsidized, including wheat, corn, and soy. Essentially, these large farms turned into agribusinesses. They used this wheat, corn, and soy and turned it into other more marketable products. And so we saw the number of processed foods increase and an increase in agribusiness as a whole, which essentially led to what the food industry has become today. We can see that between 1910 and 2000, the average number of calories consumed per person stayed pretty constant until about 1980, when the food supply became more widely available, particularly related to corn, soy, and wheat because those were the major subsidized crops. So more food became available in the 1980s, and as a result, we actually saw this increase in the number of calories that people were tending to consume every day. So there was also deregulation on Wall Street and a push toward this shareholder value movement. In other words, companies said that they must sell more in order to grow economically. And in the food sector, one of the ways to grow economically is to market to kids. So unsurprisingly, in about 1980, when we saw this deregulation occur, there was an increase in the number of dollars spent on marketing to children. It went from about $4.2 billion to $40 billion per year. And likely that food marketing had an effect. We saw portion size increasing. While it stayed relatively constant prior to 1980, after 1980 we saw the portions increase dramatically, the number of calories per person per day increased, and then we also saw a rise in the percent of kids who were overweight. So it was clearly becoming a problem. So the wealth gap obviously matters for social equality, but it has many more implications than that, and the policies that were put into place that widened the wealth gap also had a negative effect on our health. So let's switch gears a little bit to food security, obviously a related topic. For anybody who's not familiar, there is a Food, Nutrition, and Consumer Services sector of the USDA, under which all of the food, nutrition services, policies, and programs fall. So there are food distribution programs, there's the SNAP program, child nutrition programs, and then other kinds of programs like WIC, or Farmers Market Nutrition Program. You can see a fairly comprehensive list of these programs here. So during the Great Depression, policies were put into place to improve the quality of life for Americans. One of these programs was in 1933, which was the Federal Surplus Relief Corporation. This is basically a government-run organization that purchased commodity foods and distributed them among hunger relief organizations. It basically created a market for any food surplus. Between 1939 and 1943, this program was revised and became the Food Stamp Plan as part of the New Deal. As part of this plan, low-income earners could purchase the orange stamps to buy food and household items. For every $1 of orange stamps that they purchased, they received an additional 50 cents of blue stamps for very specific items. And this plan stayed in place until about the 60s. In the 60s, JFK piloted a program that still required individuals to purchase food stamps, but it omitted those surplus stamps, so those blue stamps didn't exist any longer. In 1964, though, this Food Stamp Act was revised as a way to better manage agricultural overproduction and improve the levels of nutrition among low-income individuals. Individuals could purchase food stamps that would supply them with a low-cost, nutritionally adequate diet, which was based on the economy food plan. In essence, the USDA drew out a food plan that would meet their nutritional needs and then gave individuals that amount of money to purchase those foods. Interestingly, there were some limits on what people could purchase with food stamps. So soft drinks were limited and luxury foods were limited. I think the soft drink discussion is really interesting because currently there's a debate as to whether or not sodas should be prohibited from being purchased with food stamps as well. And this program remained pretty much constant after that. In 1973, there was a provision that was included that enabled people to purchase seeds to grow their own foods. And then in 1977, there were some major revisions that happened. So people didn't have to purchase the stamps. National standards were established to determine participant eligibility into the program. The program was expanded into minority communities. There was more federal support that was provided for implementation at the state level, so states had more say in how the funds were distributed. And access was restricted to students who were enrolled in universities. In the early 1980s, since we know this was a turning point for many programs, there were severe budget cuts during Reagan. And unsurprisingly, there was a rise in hunger. In addition, this obviously widened the income gap even more because people had to spend more of their money on food since they were less supported by the government. At this time, SNAP Ed was also established as an optional program, so states could apply for matching funds from the federal government to deliver nutrition education to anybody that was at 130% or below of the poverty level. In the 90s, some of the funding was restored to combat the hunger and increase, and this was the earliest form of EBT that was introduced. So EBT is electronic benefit transfer, and the pilot of EBT cards was used to replace the actual food stamps that people were using. Very few states had SNAP Ed programs at this time, which changed about 12 years later when all 50 states had established SNAP Ed programs. In 2000, eligibility requirements were also changed to include immigrants and children who were 18 years old and younger. So prior to 2000, households that had children didn't necessarily get more money to feed the children. In 2008, there was a really important revision that placed a greater emphasis on nutrition and officially renamed food stamps to SNAP. So when I said 130% of the poverty line, what did I mean in actual dollars? Who qualifies for food stamps and who qualifies as hungry? So living at the poverty line about a year and a half ago meant that an individual was making about $12,000 per year. Or a family of four had a total income of about $24,000 per year. So you didn't have to be at the poverty line to qualify for food stamps, you could be a little bit above. A little bit above means 130% of the poverty line. So an individual would be making about $15,000, or a family of four would be making about $31,000 total. At that level, somebody would qualify for food stamps. So how many people live in poverty? About 50 million people live in poverty in the US currently. The food insecurity rate is 15.8%, so that means about 15.8% of the population is food insecure. And food insecure refers to 185% of the poverty line. So to go back a slide, 100% of the poverty line is a threshold for living in poverty, 130% of the poverty line is SNAP eligibility, and 185% of the poverty line is food insecurity. It's important to note that right now, to meet the food needs of everybody in the US who's food insecure would cost about $24 billion. And we can see how food insecurity has changed over the years. From 2011 to 2013, the degree of food insecurity on this map is indicated by darker colors. So the darker colors are the most food insecure populations. And we can see that there's an increase in food insecurity to the next time period. So there are more darkly shaded areas on this map than the previous map. So more people were food insecure by 2014 than they were in 2013. In fact, since the recession in general, we can see that food insecurity rates have risen. They've remained relatively stable around 14.5% since the recession of '08. One of the misconceptions about SNAP is that once somebody goes on food stamps, that they're on it for a long period of time, which is just simply not true. On average, people remain on SNAP for about 10 months, and then they leave the program, which means that SNAP has helped them meet their basic needs in economic downturns so they can get back on their feet sooner. Those groups that think that we should restrict sugar-sweetened beverages from SNAP benefits include anti-hunger groups, and we talked about this a little bit last week. What's really interesting is that 69% of the American public support removing sugary drinks from the list of approved SNAP products. SNAP participants also agree that sugary drinks should not be available for purchase using SNAP benefits. What's really interesting to me is this last fact. 46% of SNAP participants did not agree with removing sugary beverages from approved SNAP foods. However, almost half of them agreed with removing sugary drinks as long as there were also additional benefits included to purchase healthful foods. So in other words, people agree that incentivizing healthful food purchases with SNAP benefits are important. So what are the arguments for limiting SNAP purchases? Many people think that we should just go back to the basics and make sure that SNAP benefits are used for fruits, vegetables, and other basic foods. That was the intent of SNAP when it started in 1933, was to provide people with surplus commodities, not with packaged foods. Another argument for limiting SNAP purchases, like sugar-sweetened beverages, is the fact that SNAP already limits what people can buy. They can't buy non-food items, they can't buy alcohol, no tobacco, no food that can be eaten in the store, and no hot or prepared foods. Other federally funded programs like WIC also limit what people can buy, so there's no reason why SNAP shouldn't also be limited. Others argue that there's also medical costs involved with obesity, and the public shouldn't be supporting unhealthy food purchases when we're also supporting the medical cost of obesity, which is now around $190 billion. But there are equal arguments against limiting SNAP purchases as well. For instance, making low-income families pay separately for forbidden foods would be cumbersome and be potentially stigmatizing. In addition, banning certain products really makes the government the arbiter of what foods are good and which foods are bad, and that's more control than many people want the government to have. I want you to take a minute to watch the video now about what living on food stamps is really like. So let's talk briefly about the National School Lunch Program. The National School Lunch Act of 1946 established 4 programs that are really important. The National School Lunch Program, the Fresh Fruit and Vegetable Program, the Child and Adult Care Food Program, and the Summer Food Service Program. All of these programs serve at-need families. The Child Nutrition Act of 1966 expanded and modernized the school meals program. It established a school breakfast program and consolidated the administration of the school meals programs under the USDA. And there are some important distinctions between the school food authority and the local education agency. When a school food authority wants to operate the National School Lunch Program or the school breakfast program, they must enter into a legal agreement with the state administering agency. The school food authority is usually a school district, but it may also include sites that are under another school district, such as charter schools or private schools. The school district and the local education agency are usually the entity responsible for the overall governing and running of public schools in a county or city, or is the private school sponsor. So the term local education agency, or LEA, is used primarily in relation to free and reduced price meal application and eligibility, certification, and verification processes. So in other words, the school food authority is responsible for the administration of one or more schools and has the legal authority to operate the program, while the local education agency is responsible for certifying and verifying the free and reduced price school meal eligibility. And the school food authority has to maintain a nonprofit food service operation. This means that they have to observe limits on food service revenues, competitive foods, and managing their finances, like keeping track of all the revenues and expenditures. Reimbursable meals are priced as units. So a complete reimbursable meal has a unit price for all components, or all components selected that meet the offer versus serve requirements. However, the school food authority may set different prices because the components of different meals may be more costly than others. For instance, the chef salad meal may be $2.50, while the salmon burger meal may be $2.75. The price of a meal is set by the school food authority and is based on the school food authority's food and labor costs, in addition to the requirements of paid lunch equity. In addition, paid lunch prices need to comply with the paid lunch equity requirement. The point of service is very important in the school meals program. That's the point where the student has selected their meal and the cashier is determining whether or not it's reimbursable and notes the meal based on the student's eligibility category, either paid, reduced price, or free lunch. The school food authority has to count the number of free, reduced price, and paid reimbursable meals to serve eligible children at the point of service. So the schools must count the meal at a point where they must be able to accurately determine if the meal contains all of the required food components in the required amounts and the eligibility status of the child receiving the meal. And then the meal count is the foundation for the school food authority's claims for reimbursement. So schools can offer foods after the point of sale, but schools need some type of monitoring in place to ensure that children take the required components in the appropriate quantities and that food safety measures are also in place. An example of this is with salad bars and fruit and vegetable bars. So oftentimes salad bars are placed outside of the actual cafeteria after the point of sale. That means that children who are receiving free or reduced price lunch need to have a vegetable on their plate because vegetables are required prior to actually making it to the salad bar. So the salad bar doesn't count toward their free or reduced price lunch, even if they take it. After a school food authority serves a month of meals, they can submit a claim for reimbursement. The claims procedure is a mechanism through which the school food authorities receive reimbursement from the state agency for the meals they served. The Healthy Hunger-Free Kids Act of 2010 changed some of the nutrition standards for the school meals programs. The new standards were intended to result in healthier school meals across the country. They ensure that students are offered both fruits and vegetables every day of the week, substantially increase the offering of whole grain rich foods, limited milk to only fat-free or low-fat varieties, limited calories based on the age of children being served to ensure proper portion size, and lastly, increase the focus on reducing the amounts of saturated fat, trans fat, and sodium in school meals. So these changes began in July of 2012 for lunches and July of 2013 for breakfasts. And this has been the biggest overhaul of nutrition standards in over 3 decades. For the first time ever, the meal patterns included a maximum weekly calorie limit for lunches and separated fruits and vegetables into meal components. Before, students only had to be offered either a fruit or a vegetable, not both. And the effect is a significant increase in the amount of fruits and vegetables that are served to children on a daily basis. In the 2014-2015 school year, some changes were made to make 100% of grains whole grains. Sodium was reduced even further, and the requirement of fruits increased from half a cup to 1 full cup. In upcoming years, we also have targets to meet new low sodium levels. So there are two processes for determining who's eligible for a free and reduced price lunch. The application process is the traditional method for establishing eligibility. It's, for the most part, a self-certification system with verification of a small number of households later in the school year. So the application summarizes income eligibility and categorical eligibility. Income eligibility is probably obvious. It means that a child is eligible for free or reduced price meals or free milk based on the number of people in the household and the gross total income of the household. Categorical eligibility means that a child is eligible for free meals or free milk based on documentation. Documentation includes the fact that the child is a member of a family that is receiving SNAP benefits, is part of the food distribution program on Indian reservations, is on temporary assistance for needy families program, is homeless, is a migrant, is a Head Start child, or there are a few other categories. There's also what's called direct certification, which is another process for determining eligibility. In essence, it obtains information directly from the state or local agencies authorized to certify of a child's status as being a member of a household receiving assistance. If a child is directly certified, then that means that's in lieu of a completed application. So that's just a note on school lunches. I want you to take a look at two TED Talks now. First, watch Chef Ann Cooper, and then watch Kathy Lawrence. Chef Ann Cooper will discuss how we're going to change the school lunch program for the better, with even further revisions to the nutrition standards and to the way that food is served. And Kathy Lawrence is from School Food Focus, and they really target areas of change like policy, procurement, and what peer schools are doing.